can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave.
Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital,
Where's the Queen?
where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
Bless her, look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he all right? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they haven't enjoyed it.
I like to see immediate results and that's what you get in surgery. People come in, you have a problem, you sort them out and they go home better.
Morning.
Let's face it, nobody really wants to stay in hospital if you don't have to. You want to go and sleep in your own beds.
I just want to go and get it done.
Hello, everybody. Hello. I'm Mr. Redwood, the surgeon.
5 patients on the list.
Sit still, keep picketing. You know what I'm like.
We cover pretty much all the specialties in day surgery. So we've got paediatrics.
Urology.
Take a deep breath now.
My favourite list is probably orthopaedic. I like working with bones.
But don't ask me to go on the bronchoscopy list. Oh, no, can't be doing with that.
Ophthalmology is not my cup of tea because there's that massive eyeball staring at you on the screen. I'm sure it follows me around the room as well.
Fantastic. Well done, everybody.
King's Lynn in Norfolk. The Queen Elizabeth Hospital.
I'm feeling really nervous. I've never been put under for anything. Not having my partner here as well, it makes me a little bit more anxious.
Hello. Hi. Lovely, thank you very much. If you'd just like to have a seat then, please.
Sarah's partner has to work, so she's come alone.
I've never had an operation before, so this is why I'm quite anxious. Given birth twice, but I was awake for both of them, so this is a new thing for me. Hopefully the only one I have to have, but we'll have to see.
Hello, do I have a Sarah, Jeremy?
It's me.
If you come with me, please. Thank you.
I came here today to have a hernia operation, an umbilical hernia, and it happened after I had my second child. Things just didn't go back to normal after having her, and I noticed about 6 months afterwards something wasn't right.
On the ward, Janet's looking after Sarah.
So what have you come to have done today?
Hernia.
Para-umbilical? Around
Yeah.
this area, yeah? Okay, that's what I've got down.
When you're pregnant, your belly button, you might get so big that it pokes out a little bit. Well, mine never went completely back in, and it's because some of my bowel is poking through the muscle and pushing through. It doesn't hurt all the time. It can be uncomfortable. You can see it in certain outfits I wear.
Who's taking you home?
My mother-in-law. She's gone to Hunstanton with my daughter for the day.
Okay. Well, at least it's not too bad today.
Yeah. Having the hernia repaired is the first step of me focusing on me, getting my body back to how I want it, get my mind back how I want it. And then also I can be a better mum to my children as well, because I can run around with them a lot longer. I can do things with them.
I'll just take your temperature if I may.
I'm hoping this operation could be a life changer for me.
Surgical registrar Miss Atkins arrives to examine Sarah.
How keen are you to keep your belly button piercing?
Oh no, that closed up when I found out I was pregnant.
Okay.
Yeah, that's
Fine.
just still there.
Fine. There we go. So you've just got an arrow just to
they know.
Yeah,
there.
because we have to mark.
The operation to sort it out, we do a little cut sort of just above where the lump is, find the neck of the hernia, which is where it's poking through your abdominal wall, dissect that bit really cleanly, push the hernia back in and pop a mesh on top of it. Be a bit of pain afterwards, and there's a risk of bleeding and bruising around your belly button, and there's a risk of infection, so that might be a deep infection that needs a further operation to sort out, or it might be just a little wound infection and that can be sorted out through some antibiotics.
Okay.
And I'm scaring you now, aren't I?
This is just a lot to take in, isn't it? But no, I understand you have to tell the risk.
The other small thing I want to mention, so it's near your belly button, the hernia, and you might lose your belly button.
Yeah.
Consultant surgeon Mr. Redwood will oversee Sarah's operation.
Before you operate on anyone, you've seen them in the clinic to begin with. They're frightened when they come to see you. I know, when I've been a patient, your whole thought process changes and you become very vulnerable. So you need to know that the person who's going to be operating on you knows what they're doing and, empathise with them and say, look, I'd be frightened about that too, but we do everything we can to make this completely safe.
Mr. Redwood wants to examine Sarah's abdomen himself.
Hello.
Hi.
Hello. We've met before, I
Yes,
think.
we have.
Can we just have a quick look? Hang on,
Yeah.
let's just cover you up.
Okay.
That one there, is it? Yeah. Okay. Give me a cough. Not that one.
Yeah, that's a 2, is there?
Well, I might be.
Oh, really?
When we went to see Sarah just before the operation, we found a second hernia just above the first one, which was unexpected. And I think this highlights the importance of being examined fully again just before you start any operation, because things can change, especially while you've been perhaps on the waiting list for a while.
Hi.
You alright?
Yeah, not too bad. I still haven't gone down yet. They found that I've got more than one hernia. I've got 2. They also said I may lose my belly button. That's what I mean. I'm starting to freak out a little bit.
We'll see you in an hour or so. All right? Okay, darling, you'll be fine. Come on, I'll walk down with you. Come on. You'll be fine. Just, don't worry, my darling. You feel a long way from home, don't you, hey? Yeah. I'll see you later.
Thank you.
Okay, you'll be fine.
It's so silly, sorry. Pop your dress and going off my lap.
Next thing we need to do is get the drip in, and then we get you drifted off in.
Okay, what would you normally be doing today?
School runs.
School runs. Oh,
Sorry.
no, you're fine, my darling. Don't you worry. Don't you worry.
You look away the other way and it'll all be
That's it.
fine,
You're
all right?
okay,
Then you
my
won't
darling.
need to
It's fine.
look at what they...
I'm Karen anyway.
How many children have you got?
2.
Oh, gosh. So that's exciting time coming up with Christmas, isn't it? And expensive. How old's your son then?
7.
All right.
Yeah.
Oh, lovely ages.
Yeah, they are great.
Then we're just going to hold this. It's just a little bit of fresh air to help you think better.
Happy thoughts. All right, my darling.
We're not going to leave you till you're wide awake again, all right? We're all here to make certain everything goes safely. We look after you. You'll be fine.
Surgical Registrar Miss Atkins will perform the operation, overseen by consultant surgeon Mr. Redwood.
Okay, are we all ready?
Sarah Jeremy, and she's consented for open repair of paraumbilical hernia with mesh.
I think an incision probably down here, because we're able to get to that from here. If it comes down the midline and just swerves round slightly, and then put a big mesh on. The reason we fix hernias is because a little piece of bowel can come out through the hull and then become strangled, producing a blocked bowel. If that's the case, you then often present as an emergency and have to have a much bigger operation.
here, I think, isn't it? Well, what I would do is just one thing at a time, dissect this one out so that we can see that.
Just before coming into theatre, Mr. Redwood discovered Sarah has a second hernia, which makes the operation longer. The first step is to locate the original hernia and repair it.
Is that it? I think it is. Yeah, fantastic. So I'd just come around the back with a big clip, and then you can cut down onto it and then detach it, then you can see the abdominal wall. Stay towards the hernia, that's great. There we go. Okay, just find this second hernia now. Actually, that's quite big, isn't it? There we go. Fantastic. Look at that. That's the second hernia. For you. Yeah, we found another one. This is the one we thought we found. Okay, marvellous. Just be very careful and just use the flat of it rather than the edge, and then it won't go through. There we go.
The protruding fat can now be pushed back through the abdominal wall.
Back in it goes.
The hole is stitched up.
This is all very weak abdominal wall.
So that's the hole closed. Right.
Mesh, please.
Second potential.
A piece of mesh is laid over the weak area.
Yeah, sits well, doesn't it? No tension on it.
No tension.
Yeah, this all looks very nice.
It's sewn into place to make sure nothing can come back through the hole.
All the way around the edge.
Yeah.
Part of the mesh will dissolve in a few weeks. The rest will stay there forever.
That's covered, and it's not too tight for when she coughs. Perfect. Thank you, yeah. So, right, yeah, I thought that you did that very nicely. Excellent, thank you, right.
Hey, my love. Sarah, you're just waking up, all right? You're just waking up from your operation.
Did it go okay?
It went fine.
Oh.
Okay, sweetheart. You all right? All right, Sarah.
Oh, my tights. I'm going to get some braces for her. It's going to be 9 episodes of me pulling my tights up all the time.
Knee highs.
What, on these legs? They'll still be as high.
Hiya, are you alright? That's lovely. You just take a seat and they'll be with you shortly.
When I go to an out for YouTube, I had to have an operation. What? An operation? Oh.
Dylan Payne has come to hospital with his mum and grandmother.
What's that?
This is a shark. He's a big creature in the ocean, and he eats fish.
He loves sharks, dinosaurs, mainly sharks. We'll be having a normal conversation with him and he'll turn it into a conversation about sharks or dinosaurs.
Where do they live then?
Under the sea.
Really?
This here is a bit. There's a bunch of earwax and things having headache all in the night.
Dylan's earwax blockage regularly causes excruciating pain. It also impacts his hearing and makes him shout instead of talk.
That's funny.
He's been having a hearing issue for about a year or two, and he missed a lot of nursery. We noticed it mainly because of all the earaches he keeps having. He had an earache about at least once or twice a week sometimes.
The lump of wax is so large, doctors can't take it out while Dylan's awake.
How old is he? 4, 5, 6, 7, 8.
Today, Dylan will be looked after by Chris, who's worked in paediatrics in Kings Lynn for 20 years.
Dylan Payne. Hello. Morning. Oh my God, look at that dinosaur. Oh, can you carry them all? Come on through. I love your hat.
Thanks. It's my top one.
Is it? Shark hat. Not baby shark, is it? People ask me every day, oh, why do you want to be a children's nurse? Or how could you do children's nursing? And to me, I find that really weird because actually this is the only nursing discipline where more than 99% of our patients go home happy and healthy. In paediatrics, if I can make a patient's experience a pleasant one, then I've done a good job. So you've come to see the doctor to have your ears cleaned today?
How do you just do that?
Well, how do we clean your ears? So, because you're probably a little bit ticklish,
Yeah.
you won't keep still. So we have to have a nice little sleep. And then the doctor can have a look in your ears and see what's all dirty in there and clean them out. Right, so I'm going to do what your mother says don't do. I'm going to just draw on your hands, look.
Chris needs to numb each of Dylan's hands so he won't feel anything when the cannula goes in.
Right, so this is the magic cream. It's going to just pop it on your hand. Can you feel it cold? Good boy. Then we're going to put a very special plaster on there just to keep it nice and safe. Do you want a shark on this one?
I have no reason to know.
Is that a shark?
Thank you.
Hello. Now, Dylan Payne, and I didn't have his notes.
Dylan's surgeon is ear, nose and throat consultant, Mr. Bynon Phillips.
There is the possibility that, apart from the wax, there could be underlying blue ear.
Yeah.
Because his hearing has been down consistently and persistently, it may be reasonable for us to insert grommets. So it's a little piece of plastic with a hole in the middle that lets air into the middle ear. By doing that, it allows the fluid to dissipate and the child can hear.
Hopefully, with this procedure, he'll get less earaches and he'll be less in pain at night, and instead of waking up screaming, my ears hurting, my ears hurting.
I can do it one way better than the other, so you're...
He's got it, he's got it, he's got it, he's got it.
That's the rainbow floss.
Tom was a Tyrannosaurus Rex!
4-year-old Dylan Payne is in hospital to have an operation to fix his hearing problem.
Favourite thing about Dylan is his cheekiness and his imagination. His imagination is out of this world. That's my favourite thing about him.
Oh, I had to put my shoe on properly. That's my favourite way to put my shoe on. Hang on, let's go.
So we'll just wheel this over.
Paediatric nurse Chris is ready to take Dylan to theatre.
Hello, we're all ready. He's got his car ready. We've got a special car for him.
Oh, wow.
So you get to ride this one. Lovely. Let's go. Right, so see you soon.
See you soon.
Right, not too fast, Speedy. Right, lovely. Round to the right. Say beep beep.
Hi.
Where's that horn? I can't hear it. Well done. You okay, Mum?
Yeah.
Yeah, keep going. To my friend in the blue. Good job.
What an entrance.
Hey, dude.
Very big.
It's a big bed, yes.
Would you like to lift you up?
Anaesthetist Dr. Surendran will prepare Dylan for the operation.
Make it nice and snuggly. I'm going to blow some bubbles. Do you like bubbles, Dylan? Ready? Oh. Ready?
With Dylan distracted, Dr. Surendran can insert the cannula.
And again, last one. Oh my God, you got it. Well done.
Doing really well.
You right?
Doing well. All right, this does sting a little bit, I'm afraid. This is the only bit which is unpleasant, which is the sting. Well done.
You are a good boy. Mummy loves you.
Good boy.
He's there. He's fast asleep. Well done.
We'll take good care of him, all right? He's going to be super fine, okay?
Well done.
Well done.
Well, with him under the anaesthetic, it makes you feel a little bit upset, but yeah, he's in safe hands.
In Theatre B, Dr. Surendran and surgeon Mr. Bynon Phillips are working alongside surgical assistant Katie.
You been to the gym this morning?
I go every morning, yeah, before I come to work.
You don't have young children, evidently.
My children are 13 and 11.
They're teenagers.
Yeah.
Okay, so we're going to examine his ears. He's got wax in his ears, and he can't hear very well. So we've been trying to do this in clinic, but he's been very brave, but he just can't quite tolerate removal of the wax.
I've got it, yeah.
So how old are your children then?
Mine, 17 and nearly 20.
Good grief. So did you have any problems with wax in your children's ears?
No.
My son had wax in his ears, and he couldn't hear. It's slightly embarrassing if you're the ear surgeon and your child can't hear and you don't recognise it. So can you see on the screen? Can you see the wax down there?
Yes.
So he's completely obstructed. So they say that wax like this shouldn't cause hearing loss, but I think it does. Very careful not to. It irritates the skin of the side. So that's why it's painful to remove.
Oh, my word.
So it reminds me of that Raiders of the Lost Ark where that ball comes down the...
What, chases them through the cave?
Yeah, chases them through the...
How does that remind you of Raiders of the Lost Ark?
Wax coming out always reminds me of that. Come on.
It's stuck.
It's just...
He's going to feel much better, isn't he, bless him?
Yeah, there's no way I'd have got that out in clinic out of him, really. There you go, look. Doesn't that remind you of Raiders of the Lost Ark? Look, when it came down...
No. I can't think of anything non-Indiana Jones-like. Hey!
Aha.
Oh.
Right, let's have a look with the...
With the wax gone, it's finally possible for Mr. Bynon Phillips to investigate more serious reasons for Dylan's hearing loss.
Fine end on the suction, please.
He's concerned Dylan has glue ear, where the ear canal fills up with sticky fluid. If so, he'll insert a grommet.
So that eardrum, there's possibly some fluid on the other side of it. You see those red blood vessels?
Yeah.
That could be just irritation from the wax. It could represent a problem in the middle ear.
He makes a tiny hole in the eardrum.
Suction fine end, please.
Do you want to put a
No, it's
grommet
fine.
in?
No, there's no fluid. It's okay.
You happy?
That's it.
Lovely.
We'll just get a hearing test on him and hopefully that will have made things better. Okay, so that was examination of the ears. Hello there. Are you all right?
Yeah. That was horrible watching him go to sleep.
Oh, really?
Yeah.
Taking the wax out, no underlying problem.
Right, brilliant.
I did make a little hole in the eardrum just to have a look and see whether there's a problem. I couldn't find anything. It just appeared to be very much impacted wax.
Right.
But I'll know more when I do a hearing test.
Yeah.
Right,
We'll retest the hearing at
Should
that point
this
in time.
stop the earaches then?
I think it would be quite sore having that wax actually, because the ear canal bled a little bit because the wax was so hard impacted against it, it caused irritation.
Is that bad?
Yes, yeah, that would have been very uncomfortable. And if you'd got water in it, it would have swollen, the wax would have swollen a little bit, so it would have been quite uncomfortable.
Oh, bless you.
Hiya.
Hello,
What's his name?
Jeffrey Cooper.
Just take a seat, they'll be with you shortly.
Thanks very much. Yeah, big chairs. They look comfy.
Jeffrey Cooper's come to the Queen Elizabeth Hospital for life-changing surgery.
My feeling about the operation is obviously I'm extremely concerned. My lifestyle depends on success. Currently, I'm extremely restricted. I'm dependent largely on my wife to drive me everywhere. She's been wonderful. Without her, I would be absolutely lost. And to say the least, I've had some sleepless nights, is putting it mildly.
Have I got Jeffrey Cooper, please? Hello, would you like to come through, Mr. Cooper?
Unfortunately, I've got a detached retina. I had an operation just over 2 weeks ago to repair it, but unfortunately it hasn't taken. So now I've come back to have it done again, but in a slightly different method.
You get a window seat, so you've got a bit of a view.
The retina sends signals to the brain. When it becomes detached, it affects how much you can see. Jeffrey's surgeon is Mr. Saeed. Not only the Trust's head of ophthalmology, he's performed over 10,000 eye operations.
Actually, retinal detachment is a complex procedure. It's one of the most complex procedures that we do on eyes.
And can I check it's your right eye we're doing for you today? It's your right eye, yeah, lovely.
By and large, you can say over 90% of retinal detachment operations work. But some patients have a complex type of retinal detachment where you may have to do 2 or even 3 times repeated operation.
Yeah, well done. That's lovely. Can you see very much out of that eye at the moment?
No, nothing at all.
You can't, bless you, no.
Jeffrey also has cataracts, one in each eye.
I can't read at the moment, and I can watch the telly, but it's a bit blurred. It's quite unpleasant. The actual loss of vision has only occurred since I had the operation. Prior to that, I had limited vision, but it does mean that I'm dependent wholly on my left eye, which is not easy when it's not very good anyway.
You didn't say, though, that your aim was to hopefully one day drive and play golf.
I've given up on that. No hope of that, I'm afraid.
Drive you wherever.
Not now, you're very good. But you've got to live your life as well.
So you want my life?
Can I have the notes of patient for theatre D? It's in 2-4. I don't know where.
It should be in the trolley.
In that
yeah.
trolley.
Yeah.
Yeah, I wasn't sure. Oh, sorry.
Tamara will look after Jeffrey throughout his time in theatre.
That's fine. This says right eye, sign and sign. No allergies. Perfect. Let's
Okay.
go. Yeah, let's go.
See you later. Bye. Thank you, I'm sure I will.
Jeffrey will be awake for the operation.
Hello.
Hello.
This
Hello.
is Jeffrey Cooper. Can I take your glasses? It will make our job easier.
Yeah.
Detached retinas aren't uncommon, but Jeffrey's had issues with his eyes since birth.
I've got other eye problems which involve scarring behind the eyes, and because of this scarring that may cause a problem with it reattaching, hence the fact that we're having to do the operation again.
So let me just put this pillow under your knees. That will be more comfortable, yeah.
If the operation isn't successful, then I'm anticipating probably more or less total loss of vision in my right eye.
Hello. Hi.
It's less than 40 minutes since Sarah Jeremy left theatre after a double hernia operation. Her partner can't be with her.
My belly's quite sore. There was 2 hernias. Oh, it hurts when I breathe. I'm in a lot of pain. They're giving me some codeine. I love you. I really do.
How are you feeling?
A bit weird.
Yeah.
Yeah.
It's difficult coming around for anaesthetic.
Yeah.
It's done and dusted, gone nicely.
Brilliant.
And we'll see you in the clinic in about 8 weeks.
Perfect.
Okay, and get back to normal activity, but no heavy lifting for 3 months. Okay?
Oh, the partner's going to be bossed about. Thank you ever so much.
Okay, jolly good.
Thank you.
Thank you.
All right, bye-bye. Long gone are the days where people were kept in hospital unnecessarily. The advantages of day surgery are that you mobilise much more quickly after an operation, so you don't have the risks of lying in bed, getting chest infections and clots in the leg. And you have less risk of catching infection.
2 hours after her operation, Sarah's nearly ready to leave.
Where's Mummy? Hey?
Hello, Mummy.
How you been doing, darling?
We've been extremely busy.
Missed you. Oh, I've got a big plaster.
A big plaster?
Mm-hmm.
I see big plaster.
Oh, big plaster.
Oh my gosh.
My goodness, look at that.
Mommy feel over?
I think she did.
Are you feel over, Mama?
I think so, yeah. Don't remember it.
It's 25 minutes since Dylan's ear operation.
So he's a little bit sleepy-headed, and he's going to be a bit heavy-headed, so if he sits up, just mind doesn't slip back and fall on his head.
Hello, baby. You all right?
So sweetie.
It takes another half hour for Dylan to wake up properly.
Wiggle your bum down.
Hey, seen your dinosaur? Look.
He's got a hat on. He helped. He's got a bandage on his hand just like you.
How come we only back?
How come? He only just noticed.
We're all done. Had your little sleep, you're just waking up. 1, 2, 3. Way!
That's a big, brave boy.
Then, for being a really good boy, look what I've got for you.
Wow.
And it says on here, Certificate of Bravery to Dylan.
I have socks.
And it's got sharks
Wow. I'm feeling a lot better now after the operation, knowing that his hearing should improve. Hopefully it calms his shouting and that down, less earaches. Well, him have less earaches, obviously. And hopefully I'll get less earaches with his shouting.
Thank you for looking after me.
Thank you
I'll
ever so
take
much.
this. You are very, very welcome.
Bye-bye. Bye. It's my queen in here.
Is it? That's good.
Dylan has spent just over 5 hours in the unit.
What are you going to have for dinner?
Geoffrey Cooper is in Theatre D. He has a detached retina. Mr. Saeed's assistant, Mr. Gunda, will perform the operation. Geoffrey will be awake throughout.
Okay, Mr. Geoffrey, I'm going to give you some local anesthetic.
Okay.
Yeah, because of the previous surgery, it will be a bit uncomfortable.
Okay.
Is that okay?
Yes.
Yeah, we'll try to be as gentle as possible, but
I'm going to stay holding your hand all the time. You need to stay very still. If you need to stop for any reason or you need to cough or sneeze, just squeeze my hand, all right?
okay,
So I
yeah.
will let the doctors know that you need something.
Right.
Jeffrey underwent a similar operation a fortnight ago.
Try and do on your own.
Yeah.
See how it looks.
Yeah, sure.
It failed, which is why he's back.
During the procedure, I can feel that my eye is being fiddled about with, basically. The left eye is covered over, so I can't actually see what's going on. But it's the eye itself is frozen, so it's no pain or real discomfort.
Lights down, please.
Send to the scope, please. Move away from the cornea. It's a total detachment.
Yeah, totally.
Yeah. That break is opened up inferiorly, you see. Okay. I'll just. Can I have a gown and gloves, please?
It's not just the retina which has become detached. The choroid, which supplies oxygen to the retina, has also come away. The complexity means Mr. Saeed has no choice but to take over.
Okay, let's see. Q. It's a total choroidal detachment, you're right. You've seen lots of failed detachment, but you haven't seen anything like that.
Yeah.
Mr. Cooper.
Yeah.
Now we just have cleared out the hemorrhage from the eye. There is quite a large near total retinal detachment. Now it seems quite unusual in the sense that there is a lot of scarring, and the detachments with scarring don't do very well, I'm afraid. So, our options are really limited. We're going to either complete this operation with removing most of the scarred retina and fill the eye with oil. At the end of that, the outlook for vision is going to be very, very limited, I'm afraid. Our option 2 is that we don't do any more and just close up.
So which option gives me the chance of seeing anything at all?
I think we can say marginally better with the first option. It will not be reading vision. You might be able to appreciate movements in front of this eye.
That's all.
Yeah.
It's the news Jeffrey has been dreading.
It's always a difficult question, delivering a bad news. You yet have to detach from the emotional side of it. When you're operating, you just have to do it as if you're doing a mechanical job. As if I'm fixing an old car. I don't want to think about what's going through patient's mind. And all that will come afterwards. And I will know that I will speak to this patient afterwards.
Mr. Saeed takes another look at the back of Jeffrey's eye.
So we've decided that we're not going to abandon, but as I said, the outlook is not terribly encouraging, but we will give you a benefit of doubt and put oil in the eye. This is the best we can do. Wash, please. Saline. Yeah, oil in, please.
Injection.
So this is silicone oil. All on, that's good.
Here we are.
Okay.
All right, my love. So, this is all right.
Yeah.
The nurse will be with you in a minute.
Okay.
All right, and she will offer you a drink or whatever you need.
Okay, thank you.
Okay, bye-bye.
No.
What? What?
I won't be able to see it this time.
Oh, darling. I'm sorry. Is that what they said?
Yeah, more or less. I won't see hardly anything at all. Oh dear. I don't know what I'm going to do, Six.
We'll get through it.
Yeah, the nurse that was holding my hand, she was holding my hand. And then when that started getting a bit nasty and it looked a bit dodgy, she put her other hand on as well.
Did she? I don't think I'd like to do that job.
No. One good thing that's I've got the flashing. I haven't got the flashing that side now.
Oh, haven't you?
No, nothing. Just nothing.
As expected, Jeffrey's operation did not work. He remains blind in his right eye. He's exploring options in private healthcare.
Okay.
Yeah, you?
Yeah.
Sarah spent a week in bed at home being well looked after. She can now run around with her children again.
Do you want me to take a picture of you?
Yeah.
And Dylan's earaches that used to wake him in the night have stopped. He does still shout though, so he's waiting for another hearing test.